Feel like your memory isn't as sharp as it used to be? Struggling with mental fog? The answer might be sitting in your medicine cabinet right now. There's one incredibly common medication that millions of seniors take daily with a secret side effect nobody warned you about. It actively slows your brain down. I'm Dr. Robert Harrison, and today we're not just identifying the culprit, we're giving you actionable, science-backed strategies to reverse its effects and reclaim your mental independence. Here's something that should alarm everyone watching this. A significant percentage of seniors are currently taking medications with unacknowledged cognitive side effects. Research shows that somewhere between 8 and 37% of older adults are using these drugs regularly, often without understanding the impact on their brain health. Many don't realize that subtle changes they're experiencing, like forgetting where they put their keys, struggling to find the right word, or feeling mentally foggy, aren't just getting old. These changes could be direct side effects of medications sitting in their medicine cabinet right now. The silent nature of this problem makes it particularly dangerous. Unlike medications that cause immediate, obvious side effects like nausea or dizziness, these drugs steal your mental sharpness. So gradually that most people attribute the decline to normal aging. But it's not normal, it's preventable. And understanding what's happening is the first step toward reclaiming your cognitive independence. Let me introduce you to the primary culprits we're talking about today: anticholinergic medications. Now that's a mouthful of a medical term, so let me break it down in plain language. These are drugs that block the action of a crucial chemical messenger in your brain called acetylcholine. Think of acetylcholine as one of your brain's most important communication systems. It's the neurotransmitter responsible for transmitting signals between brain cells, and it plays an absolutely critical role in memory formation, learning, and maintaining mental clarity. Acetylcholine is particularly important in areas of your brain involved in attention, concentration, and the ability to form and retrieve memories. When this neurotransmitter is functioning properly, your brain can process information efficiently, store new memories, and recall them when needed. But when medications block acetylcholine's action, it's like throwing sand in the gears of a finely tuned machine. The system starts to slow down, malfunction, and eventually significant problems emerge. Now here's where this gets particularly concerning. Many of the medications with strong anticholinergic effects are drugs that seniors take every single day, often for very common conditions. Let me walk you through some of the most frequent offenders. First, certain antihistamines. The prime example is diphenhydramine, which you probably know by its brand name, Benadryl. This over-the-counter medication is found not just in allergy pills, but in countless sleep aids and nighttime pain relievers. Products like Tylenol, PM, Advil, PM, Excedrin, PM, Unisum, Sominex, and many others contain Diffie. People take these medications thinking they're harmless because they don't need a prescription, but they have strong anticholinergic activity. Every time someone takes one of these pills to help them sleep, they're blocking the very neurotransmitter their brain needs for healthy memory function. Second, medications for overactive bladder. These include drugs like oxybutynin, sold under brand names like Dropan, Gallic, and Oxyrol, as well as Tultradine, known as Drol. Millions of seniors take these medications to manage urinary urgency and incontinence. While they can be effective for bladder control, they work by blocking acetylcholine receptors. And unfortunately, they don't just block them in the bladder, they block them throughout the body, including in the brain. Third, certain antidepressants, particularly the older tricyclic antidepressants like Dosipin, known as Sinoquin, amitriptyline, sold as Elvil, and others in this class. While newer antidepressants like SSRIs generally have fewer anticholinergic effects, these older medications are still frequently prescribed, especially for conditions like nerve pain or insomnia. Fourth, medications for vertigo and motion sickness such as mecloine, sold as Antivert or Bonine. And fifth, certain medications used in Parkinson's disease management also have anticholinergic properties. Now here's what actually happens in your brain when these medications block acetylcholine. Research from the University of Washington followed nearly 3,500 adults aged 65 and older for more than 7 years. What they discovered was alarming. During that time, 800 participants developed dementia. When researchers examined anticholinergic drug use, they found that people who used these medications were significantly more likely to develop dementia than those who didn't use them. But here's the truly concerning part. Dementia risk increased along with the cumulative dose. A landmark study published in JAMA Internal Medicine in 2015 found that taking an anticholinergic medication for the equivalent of 3 years or more was associated with a 54% higher risk of developing dementia compared to taking the same dose for 3 months or less. That's more than half again as high a risk simply from long-term use of medications many people consider routine. More recent research published in 2019 examined over 58,000 patients diagnosed with dementia and more than 225,000 matched controls. This massive study confirmed the association between anticholinergic drug exposure and increased dementia risk, finding particularly strong connections with antidepressants, bladder medications, and antiparkinson drugs. A comprehensive meta-analysis examining 25 different studies concluded that using medications with anticholinergic effects was associated with approximately a 20% increased risk of all-cause dementia with clear evidence of a dose-dependent relationship. The more anticholinergic medication you take and the longer you take it, the higher your risk. Now let's talk about what these drugs actually do to your brain function. Beyond just the long-term dementia risk, the cognitive impairments caused by anticholinergic medications extend far beyond simple memory loss. People experience reduced attention span, finding it harder to focus on tasks or conversations. They struggle with difficulty concentrating, making it challenging to read, follow instructions, or complete complex activities. Executive function becomes impaired, which means problems with planning, organizing, and making decisions. Mental processing speed slows down, so it takes longer to think through problems or respond to questions. These aren't subtle effects that only show up on specialized testing. They impact daily life in very real ways. Seniors taking these medications experience increased risk of falls because their reaction times are slower and their balance is affected. They make more medication errors because they struggle to remember which pills they've taken or when to take them. Their independence gradually erodes because tasks that used to be routine, like managing finances, cooking, or driving, become increasingly difficult and dangerous. What makes this particularly insidious is that the effects are cumulative and worsen over time. Each day, each dose adds to the burden on your brain. Someone might start taking diphenhydramine occasionally for allergies, then begin using it nightly for sleep. A few months later, their doctor prescribes oxyettin for bladder control. Suddenly, they're taking 2 strong anticholinergic medications daily. Their family notices they seem more forgetful, more confused, but everyone, including the person themselves, assumes it's just age. Nobody connects it to the medications. Research has also shown that the damage may not be entirely reversible. While the general view has been that anticholinergic-induced cognitive impairment reverses when you stop the medication, newer evidence suggests that long-term use may cause lasting changes. The University of Washington study found that dementia risk linked to anticholinergic medications persists and may not be reversible even years after people stop taking these drugs. This means the damage accumulates over time, and at a certain point, stopping the medication may not fully restore cognitive function. So what can you do right now to protect yourself? First and most important, do not stop any medication without consulting your healthcare provider. Some medications need to be tapered gradually, and stopping abruptly could be dangerous, but you absolutely should start a conversation with your doctor or pharmacist about potential anticholinergic effects. Come to your next appointment prepared with specific questions. Ask, are any of my current medications anticholinergic? If so, are there alternative medications with less impact on cognitive function? Can we review whether I still need each medication or if we can reduce the dose? Bring all your medications, including over-the-counter drugs and supplements, to your appointment. Dump everything into a bag and let your doctor review the complete picture. Many seniors are surprised to discover they're taking multiple anticholinergic medications without realizing it. There are often excellent alternatives available for allergies. Instead of first-generation antihistamines like diphenhydramine or chlorpheniramine, newer second-generation antihistamines like laoretine, sold as Claritin, or cetirizine, known as Xerec, have minimal anticholinergic effects. For sleep problems, instead of Benadryl-containing products, consider trying melatonin supplements, which work with your body's natural sleep-wake cycle, or behavioral changes like establishing a consistent sleep schedule, avoiding caffeine after noon, getting regular exercise, and practicing good sleep hygiene. For depression, instead of tricyclic antidepressants, selective serotonin reuptake inhibitors like citalopram G, sold as Celexa, certain known as Zoloft, or fluoxetine called Prozac, generally have fewer anticholinergic effects. Counseling and cognitive behavioral therapy can also be highly effective for treating depression, often working as well as or better than medication. For urinary incontinence, the alternatives are more limited but still worth exploring. Mirabegron, sold as Mirbatri, is a newer medication that works differently and is not anticholinergic. Additionally, non-pharmacological interventions can be remarkably effective. Pelvic floor exercises known as Keeley exercises strengthen the muscles that control urination. Bladder training programs teach you to gradually extend the time between bathroom visits. Setting regular bathroom schedules using reminders to urinate every hour or two, even if you don't feel the urge, can prevent accidents. Physical therapy specifically focused on pelvic floor dysfunction can provide techniques and exercises tailored to your needs. For motion sickness or vertigo, discuss with your doctor whether the underlying cause can be addressed directly rather than just treating symptoms. Sometimes vestibular rehabilitation therapy, a specific type of physical therapy, can be more effective than medication for certain types of dizziness. Beyond medication changes, there are lifestyle factors you can optimize to support your cognitive health. Regular physical exercise has been shown to increase acetylcholine production in the brain and improve overall cognitive function. Even moderate activity like walking 30 minutes daily makes a significant difference. Mental stimulation through activities like reading, puzzles, learning new skills, or engaging in hobbies keeps your brain active and resilient. Social engagement, maintaining connections with friends and family, participating in community activities provides cognitive benefits and emotional support. Quality sleep is absolutely essential for brain health. During sleep, your brain consolidates memories and clears out toxins that interfere with cognitive function. Aim for 7 to 8 hours of quality sleep each night. Nutrition also plays a role. Foods rich in choline, a precursor to acetylcholine, include eggs, nuts, broccoli, and cauliflower. A Mediterranean-style diet rich in vegetables, fruits, whole grains, fish, and healthy fats has been associated with better cognitive outcomes. Stress management matters too. Chronic stress has negative impacts on memory and cognitive function. Practices like meditation, deep breathing exercises, yoga, or simply spending time in nature can help reduce stress levels. Regular meditation has actually been shown to increase acetylcholine production in the brain. Now, let me address an important point about the Anticholinergic Cognitive Burden Scale, or ACB scale, developed by researchers at Indiana University School of Medicine. This scale ranks medications according to the severity of their effects on cognition, with scores ranging from 1 to 3. Medications with an ACB score of 3 have the strongest anticholinergic effects and pose the highest risk. These include diphenhydramine, oxybutynin, tricyclic antidepressants, and others. Medications with scores of 1 or 2 have milder effects. Your doctor or pharmacist can help you identify where your medications fall on this scale and whether safer alternatives exist. It's particularly important to be aware of the cumulative effect when taking multiple medications. Even if each individual drug has only mild anticholinergic properties, taking several together can create a significant burden on your brain. This is especially common in seniors who are managing multiple health conditions and taking medications prescribed by different specialists who may not be communicating with each other about the total medication load. Here's something that often gets overlooked. Many over-the-counter medications have anticholinergic effects, and people don't think to mention them to their doctors. Cold and flu remedies, sleep aids, motion sickness pills, even some eye drops and nose sprays can have anticholinergic properties. Always tell your healthcare providers about everything you're taking, including supplements, vitamins, and over-the-counter products. For those who are already experiencing cognitive changes, there's still hope. Research has shown that reducing anticholinergic medication load can improve memory performance and alleviate cognitive symptoms. Some studies have found that people with mental illness who reduced their anticholinergic burden showed improvements in memory. Others found that reducing these medications helped alleviate behavioral and psychological symptoms in dementia patients. While the improvement may not be complete, if you've been taking these medications for many years, many people do see meaningful recovery of function when they work with their doctors to reduce or eliminate anticholinergic medications. The message I want you to take away from this is one of empowerment, not fear. Yes, these medications pose real risks to brain health. Yes, millions of seniors are taking them without understanding the consequences. But knowledge is power. You now know what to look for, what questions to ask, and what steps you can take. Your brain health is not a fixed destiny. Proactive steps can make a significant difference. Regular cognitive checkups with your healthcare provider can help detect problems early. Open, honest communication with your doctors about all your medications and any cognitive concerns you have is essential. Don't dismiss memory problems or mental fog as just normal aging. Investigate whether medications might be contributing. This is particularly crucial if you have a family history of dementia or Alzheimer's disease. While you can't control your genetics, you can control modifiable risk factors. and medication choices are one of the most significant modifiable factors affecting cognitive health. Remember, the goal isn't to stop all medications or to live in fear of every pill. Medications serve important purposes and improve quality of life in countless ways. The goal is informed decision-making, balancing the benefits of medications against their potential risks, and ensuring you're taking the right medications at the right doses for the shortest time necessary. If you care about your cognitive future, if you want to maintain your independence and mental clarity as you age, take action today. Schedule an appointment with your doctor specifically to review your medications. Bring this information with you. Ask the hard questions. Advocate for yourself. Your brain is worth protecting. Share this video with a senior you care about. Knowledge is the first step to reclaiming your sharpest self. Together, we can raise awareness about this widespread but often overlooked threat to cognitive health. Your mind is your most precious asset. Guard it carefully, protect it wisely, and never assume that just because a medication is common or available over the counter, it's harmless. This is Dr. Robert Harrison reminding you that awareness and action are your best defenses against cognitive decline. Take control of your brain health.